Thank you for attending this session of Tennessee Medical Association's Spotlight Videos. Today's video will be on the Tennessee Healthcare Innovation Initiative's 2015 Technical Advisory Groups, also known as TAGs. These are several new episodes of care the state is planning to design later this year, as well as the patient-centered medical home aspect of the initiative, and the TMA needs physicians who are willing to participate in the design process. Before we get to the purpose of this spotlight, you may need some background information. What is the Tennessee Healthcare Innovation Initiative? In the broadest sense, it is the state's way of shifting how insurers pay for health care in order to emphasize value-based payments. The goal is to reduce the cost of care provided in Tennessee while increasing its quality. The state's plan has four main components: incorporating retrospective episodes of care-based payments, developing patient-centered medical homes and health homes, focusing on long-term care services, starting new population health initiatives. Most of the state's work so far has been on the episodes of care piece, but they will also start designing the primary care transformation part of the initiative with PCMH and health homes this year. The state is funding this initiative through a grant from the federal CMS Innovation Center. In early 2013, TennCare applied for and received a State Innovation Model Design Grant of roughly $756,000. It then used that money to start doing exactly what the name implies, designing their payment reform plan. Building on its design plans, the state applied for a much larger grant, and in December 2014, it received a State Innovation Model Testing Grant in the amount of roughly $65 million, which they will use to implement the design of the initiative. This is a very brief description of the initiative and its background. If you would like to know more details, please visit TMA's TennCare Payment Reform webpage for more detailed information. Again, the primary focus of the initiative so far has been the episodes of care piece. So what is it? An episode of care encompasses a selected condition or major procedure and includes any clinically related services over a period of time surrounding the condition or procedure. Instead of focusing on each individual procedure, office visit, or test performed, episodes of care will look at the total cost of all the procedures surrounding a specific health care incident. When most people hear episodes of care, they think bundled payments, which is where a provider receives a lump sum of money for a certain procedure and has to work within that sum. However, that type of payment is considered a prospective episode of care. In a retrospective episode, like the kind the state is developing, providers are still reimbursed fee-for-service up front, and then the payer looks at the cost associated with that episode on the back end. The way that will work is, after a specific time period known as the performance period, the payer will identify through claims data the primarily accountable provider, the PAP, or the so-called quarterback for each episode of care. The quarterback is supposed to be the provider who has had the most control over the cost of that episode. In other words, the provider who performed the procedure, ordered follow-up tests, reserved the OR, and referred the patient to a specialist. For example, for the perinatal episode, which is the one that the state has already designed, the episode includes the 40 weeks prior to the delivery and 60 days following. The quarterback is the provider who delivers the baby, typically an obstetrician, which means that provider is responsible for the most of the cost incurred during that episode. That provider is also responsible for ensuring that certain quality measures are included in the episode. At the end of the performance period, the provider may receive shared savings or have to pay back a penalty to the payer. Cost sharing will depend on the cost of all the perinatal episodes he or she performed during that period compared to the episode costs of other obstetricians. Starting this year, the state will begin to develop another layer of the initiative called the Primary Care Transformation. They plan to design and implement patient-centered medical homes for primary care providers and health homes for patients with severe and persistent mental illnesses, or SPMI for short. By 2020, the state plans to include 65% of all primary care providers in Tennessee in a PCMH model covering 2.6 million patients. In general, the purpose of PCMH is to coordinate care delivery through team-based care by focusing on disease prevention and reducing unnecessary healthcare costs. The specific details of the state's PCMH model are yet to be determined, but there are some aspects we know about. All patients will be attributed to a specific PCP within the PCMH. Also, practices will be required to become PCMH accredited by the National Committee for Quality Assurance, or NCQA, which may be a lengthy process for some practices. The PCMH model will also include what the state refers to as a shared care coordination tool. The tool will collect data from hospitals on all admissions, discharges, and transfers that occur, and push that information out to the patient's PCMH provider. The provider can then use that data to follow up with patients and create a treatment plan. SPMI health homes are similar to PCMHs, but focus only on patients with mental illness, which the state predicts will be approximately 55,000 TennCare patients. The health homes will coordinate with the PCMHs for more streamlined care delivery and will also receive the ADT feeds through the Shared Care Coordination Tool. The details are yet to be designed, but the state has said they will utilize CMS's Health Home Core quality measures to track improvements in the quality of care provided, and health home providers will be paid on per member per month basis. You can read more about the primary care transformation on TMA's Payment Reform webpage. Now that you know a little about the Payment Reform Initiative, let's get to the purpose of this spotlight. Technical Advisory Groups, or TAGs for short. For the episodes of Care portion, TAGs are groups of clinicians who design the clinical aspect of each episode included in the initiative. The members are mostly physicians, but there are some allied professionals, such as nurse practitioners and physician's assistants. Health insurance company representatives are included as well, but the TennCare Bureau has specifically rejected the inclusion of practice executives and administrators in TAGs. Responsibilities for TAG members include describing the patient journey for the health incident included in the episode, defining the window of time surrounding the incident, identifying the provider most responsible for caring for the patient, the quarterback I have previously mentioned, choosing the quality measures that will be required for each episode, and recognizing factors that may trigger a patient's episode to be adjusted for risk, such as an extraordinary medical condition or comorbidities. All of these responsibilities relate to the clinical aspects of the episodes of care. TAG members will not necessarily discuss or determine other factors, such as pricing for certain procedures, health plan contracts, or the cost thresholds for each episode. Physicians who are chosen for TAGs should expect to commit their time, but only for a couple of months. First, you'll have at least one, possibly two chances to participate in an introductory webinar provided by the TennCare Bureau. It will provide more information on the details of the Patient Reform Initiative and explain what exactly the TAG members will be asked to do. Next, each member will be required to participate in 2 or 3 in-person meetings in Nashville. The TMA has been trying to determine if there is another alternative to the in-person meetings, since traveling to Nashville can take a significant amount of time for some physicians. However, as of now, the state is requiring each member of the TAG to be present at every scheduled meeting, as meetings tend to be more productive in person. It is important to note that if you decide to participate on a TAG, travel expenses will not be reimbursed by the state or TMA. In addition, TAG members will also have some materials to review in preparation for the meetings. The way the design process works is the state will present a base episode definition for the tag, and then the tag will expand or change the definition if necessary. In order for the meetings to be productive, members will be expected to review these base definitions beforehand. Finally, tag members should feel free to seek feedback from colleagues. Discuss the episode design with other physicians and your practice executives and take any suggestions back to the group. The state needs all the input it can get from individuals with the necessary expertise. This chart represents the state's timeline for designing each episode of care to be included in the initiative. As you can see, it plans to design 75 episodes within 5 years, ending in 2019. So far, tags have finished 7 episodes and are in the process of designing 6 more, represented in waves 1, 2, and 3 at the bottom of the chart. The state may use one tag to design multiple episodes depending on the physician specialties required. For example, in wave 3, upper respiratory infections is paired with pneumonia in one tag, and upper GI endoscopy is paired with GI hemorrhage in another. Starting soon, the state will start seeking nominees for the episodes listed in Wave 4. Wave 4 episodes include Attention Deficit Hyperactive Disorder, or ADHD, Oppositional Defiant Disorder, or ODD, Congestive Heart Failure Acute Exacerbation, Coronary Artery Bypass Graft, and Cardiac Valve Replacement. The state may choose to group some of these episodes into one tag, similar to those episodes in Wave 3. Once it starts actively seeking nominees for these episodes, the state will list specific specialties for each. In the meantime, if you either perform these procedures or would consider yourself a quarterback for any of these episodes of care, physicians within your specialty will likely be included in the tag. Physicians with significant clinical experience in these procedures or conditions should consider nominating themselves for Wave 4 tags. For the PCMH and Health Home tags, the state has already announced the timeline for nominations and the dates for meetings. They expect to have roughly 20 clinicians for each of the 2 tags, mostly primary care providers for the PCMH tag and mental health professionals for the Health Home tag. So please contact TMA as soon as possible if you would like to participate. We have the meeting dates listed on our website for you to review. Responsibilities for these tag members will include providing feedback on the data reports that PCMH providers will receive, the comprehensive risk assessment content, and any provider actionable data to be provided, including ADT feeds, pharmacy claims, risk scores, and gaps in care. Tag members will also identify which quality metrics and possible outcome measures that PCMH providers will be required to achieve. Finally, members will determine what kind of support providers will need, such as training and additional staff, and how best to develop partnerships between primary care and behavioral health practitioners. Why should you participate in a tag? Primarily because this payment reform initiative is the future of healthcare reimbursement in the state, and physicians need to be actively involved in its design. First of all, you are the clinical expert, so your expertise is needed to develop the best episode or PCMH design for your specialty. The best healthcare consultants in the world cannot provide the type of real-life experience and skills that physicians have. Second, physician voices are needed in these tags. Hospital executives, insurance representatives, and allied healthcare professionals will be participating in these tags. Decisions about the design of each episode will be made by these individuals if physicians do not participate. Finally, if you perform any of the Wave 4 episodes listed or have experience in primary care or mental health care coordination, your reimbursement both for TennCare and commercial payers will be affected within the next few years. Most people involved with the healthcare industry agree that the current payment models are not sustainable. Payment reform is needed and is coming one way or another. Shouldn't physicians be the drivers and decision makers for that reform? If you are interested in participating in a tag for any of the Wave 4 episodes, the PCMH or Health Home Design, or for any other episodes to be designed at a later date, please contact Katie Daggeford, Assistant General Counsel for the TMA, at the email address on this slide. She will collect all nominee information and pass it along to Dr. B.W. Ruffner, one of TMA's past presidents and the lead physician member for the Tennessee Payment Reform Initiative. Dr. Ruffner will then reach out to all nominees before TMA officially submits its list to the state for consideration. Keep in mind that submission by TMA does not guarantee a spot on a tag. All positions on tags are ultimately decided by the state. In your email to Mrs. Daggeford, you will need to include some basic information such as your name, email address, phone number, city, and the practice or facility with which you are affiliated. Also, please include the tag or episode in which you are interested in participating and your relevant specialty or subspecialty. Finally, include a brief description of why you should be chosen for a tag membership. This can be just a couple of sentences explaining your background, board certification, and experience. To find out more about the Tennessee Healthcare Innovation Initiative, you can visit the state's website at the address listed on your screen. It has tons of information on the initiative and is updated on a regular basis. We also encourage you to visit TMA's webpage on the initiative, which includes an explanation of the initiative's background and TMA's involvement. If you have any questions about anything we have said in this webinar, or about the Tennessee Payment Reform Initiative in general, please contact the TMA Legal Department at legal@tnmed.org or call us at 1-800-659-1862. You can also visit our website at www.tnmed.org for continuous updates on the initiative and any other laws or issues affecting the practice of medicine in Tennessee. We also have an extensive law guide with over 150 topics related to the practice of medicine, which you can find at the link printed at the bottom of your screen. This resource is for TMA members only, so you'll need your member ID and password to access any of the law guide topics. If you are not a member and are interested in joining TMA, please visit our website to learn more and begin the registration process. Thank you for joining us for this session of TMA Spotlights. Be sure to look for future updates to this spotlight.